Hello and welcome to another episode of Clean Talk. I'm your host, Brad Whitchurch, and we are recording live from the Seal Shield studios in beautiful downtown Orlando, Florida. Today is June 27th, 2023, and it is the week of the APIC conference here in Orlando, Florida. APIC, of course, the Association for Professionals in Infection Control. And we've taken some time away from the conference today to talk about one of the most exciting innovations in infection prevention, and that is UV technology. And we have a big announcement here today. I'm very excited to announce that Seal Shield has acquired a leader in UV technology, CleanSlate. And joining me here today to talk about those products and that technology and applications, I've got two esteemed guests, Kevin Truong, formerly of CleanSlate and now with Seal Shield, and Seal Shield Chief Technology Officer Christian Davis are here with us to talk about all things UV and to talk about the benefits of using UV technology in your infection prevention protocols and which UV is best for which applications, because not all UV is the same. Isn't that right, gentlemen?
That's right.
Fantastic. Well, Christian, why don't we kick it off with you? Why don't you tell us a little bit about how Seal Shield got into the UV space, and maybe tell us a little bit about the ElectroClave, the legacy product for UV technology from Seal Shield.
Yeah, absolutely. Thanks, Brad. So the ElectroClave was developed even going back as far as 2015. Hard to believe that many years has already passed since we got into this space. But it came very simply put. We primarily at Seal Shield historically have dealt with IT within healthcare. Our washable keyboards and mice really serve a benefit to both infection prevention as well as IT and providing washable peripherals to mitigate cross-contamination in the healthcare system. And like most industries, mobile applications and mobility was starting to rise in healthcare to serve workflow needs for patients, improving efficiencies and outcomes with such appliance changes. So you started to see mobility showing up in healthcare systems beyond just the personal phones and tablets. You saw organizations starting to adopt tablets and phones on a wide scale, thousands of devices sometimes in cases at facilities. And they quickly realized that, hey, we have a problem. How are we going to manage these devices, both physically? How are we going to clean these devices, both digitally and biologically? So they had many problems at hand. And of course, our advisory board at Seal Shield came to us with these problems and asked for our suggestion and our inputs, and they were equally involved in providing inputs towards our design. And the ElectroClave was born really on the back of IT, realizing that they were bringing a technology into healthcare that was subsequently creating a new problem, and they wanted to resolve it and address it from day one. So that's where the ElectroClave began.
Thank you, Christian. As you mentioned, Seal Shield probably best known for the washable keyboards and mice. And as EMR systems were implemented, facilities went to a highly mobile-centric solution and started replacing notepads with cell phones and PDAs and tablets. And now that becomes a challenge not only for IT, but for infection prevention. And UV was a great solution for addressing the cross-contaminations around those devices. You know, guys, some people say that the cell phone is the most dangerous device to ever come into the hospital because it is going to unprecedented wide areas of the facility that other devices just don't go to. So critical to have a solution to address those devices. And as you said, Seal Shield has been in the UV business since 2015, but this technology has been around for decades and decades and really got, I think, greater awareness as a result of COVID. We've seen more and more UV solutions come onto the market, particularly in healthcare. And one of those great solutions is now in the Seal Shield portfolio, and that is the CleanSlate device. Kevin Truong, what can you tell us about CleanSlate and how you guys came about originally and the role that CleanSlate plays in healthcare and other cross-contamination environments?
Oh, sounds good. Thank you for having me here. So the CleanSlate journey is very similar to that of Seal Shield as well, too. We began back in around 2016. The original founders were big germaphobes, and the cell phone was one of the most distinctive and yet dirtiest objects lying around at all times. Where the CleanSlate originated from a healthcare perspective, we began in the NICU. The NICU process, you have it's one of the most vulnerable patients, and one of the common processes in the NICU is the method of bagging, sanitizing all incoming devices from staff, visitors. It's a very process that's hard to control and hard to maintain. But where CleanSlate came into picture is how we could create a very rapid sanitation process, a very easy to use, and a simple process that will be maintained throughout all these high traffic areas, especially where visitors, patients, and ultimately staff can actuate a product at all times.
So a healthcare-driven solution specific to the NICU and I assume other highly infectious areas,
yes,
replacing an archaic system of bagging and tagging and allowing those devices to be rapidly disinfected in a highly contagious environment.
Exactly. We began in the NICU and slowly saw evolution into more and more areas of the hospital that saw similar pain points where rapid disinfection became truly a need, and saw a method where improving current infection prevention protocols and how to maintain these aspects throughout the facility.
Well, obviously, SealShield is very excited to have these two fantastic technologies, and they have different workflows, different applications, and actually, even though they're both UV products, the technology is quite a bit different. Isn't that right, Christian? What can you tell us about that?
Yeah, correct. In healthcare, there's no one solution, one size fits all. There's no silver bullet. We would like to think that each of us develop a product that is a silver bullet, but there is no such thing. So the ElectroClave, where the differentiation begins with the ElectroClave versus the CleanSlate and where they really begin to complement each other, as Brad suggests, is the ElectroClave is designed to be an enterprise-based solution, right? So like I said earlier, hospitals, they're not deploying 20 phones, 20 tablets. They're deploying thousands of phones, thousands of tablets. With that headache comes more than just, like I said, the cleansing of the biologics, right? So making sure that these devices are not contributing to cross-contamination, but they've also got to deal with software. They've got to deal with applications. They've got to deal with where are those assets, going? Who has them? Where were they last seen? There's many, many problems. We got to charge them. We got to store them. So the ElectroClave begins to solve all of those problems all at once, right? So, high level, if we look at the ElectroClave, we're going to disinfect, we're going to charge and allow re-imaging and provisioning of assets to all occur simultaneously to minimize downtime and to ensure that a fleet is ready to go between shift changes or between, day one to day two. So you depend upon if it's a shared environment or it's a BYOD environment. That's where the ElectroClave and the CleanSlate may end up on the same floor, maybe touching some of the same similar devices. But there's a lot of enterprise management that needs to occur. And then there's a lot of on-the-go rapid sanitization that needs to occur. So that's where these two come together and blend. And by the way, just to clear up acronyms, because we're already using some here, NICU, for those that are listening to us that are not in healthcare, that is a neonatal intensive care unit. So that's where the babies are born premature and they need additional special care. But then, the family and the parents want to come visit the babies. They need to go through a cleansing and a disinfection process prior to entering the nursery, if you will. So just for those of you that weren't aware of NICU, I thought I would clear that up.
Christian, you're usually the acronym guy. I appreciate you being a heads up on that. And that's right. So the ElectroClave really geared towards an enterprise environment. It's a badge in, badge out solution. All the devices can be RFID tagged. So from an IT standpoint, those assets can be easily managed. You know which asset is checked out to which individual and what the status is of that device from an infection prevention standpoint. And correct me if I'm wrong, but you can send push notifications that are customized. So if, for example, you're in the NICU, you can say this is a highly infectious area and devices in this area need to be cleaned more often than maybe a general area of the hospital.
Correct. That was one of the greatest differences or differentiations between the CleanSlate and the ElectroClave. So with the ElectroClave, we want to put the information of the awareness of what's been disinfected when and where, not only into a report or into analytics that then someone in the hospital has got to consume and then make decisions upon. The system takes it a step further. It actually then sends those notifications at both the device level and the user level, so that then the staff is aware, and awareness is key, right? Do I have a dirty device? Do I have a clean device? You can't pick up a device and determine biologically, is it clean or not? So the ability of the system to monitor that and give them that real-time information allows them to make better decisions, again, resulting in better outcomes for patients because we're reducing the risk of cross-contamination. That's paramount.
So enterprise application for facility-owned devices, potentially, where IT needs to track those devices. You need to have parameters around infection prevention. But let's face it, this technology is beneficial to all of us. And sometimes just the patients or the visitors want a rapid disinfection. They're not worried about asset management. It's their personal device. They're not worried about tracking those devices. They want a personal device, easy, rapid disinfection, and that's where the CleanSlate comes in, right, Kevin?
Yes, of course. That's where CleanSlate ultimately excels in providing extremely easy to use solution to those that encounter a UV disinfection device for the very first time. The CleanSlate usually is when one encounters the device, they understand how to use it within seconds, and they can begin their disinfection cycle. And the 20 seconds, ultimately, it is the fastest solution in the market for rapid disinfection, especially one that is for healthcare grade use.
Well, you make a great point. The benefit of the CleanSlate is rapid disinfection. So how long does it take if you put your phone in the CleanSlate device in a waiting room or at a hand washing station at a healthcare facility? How long do you wait to get that device sanitized?
You wait 20 seconds. And the 20-second is actually because that 20 seconds provides you enough time to sanitize your hands effectively, and then you have clean hands to retrieve your clean device.
So let's talk a little bit about that. I know one of the successful applications of CleanSlate is to install the CleanSlate UV disinfection systems at hand washing stations. What have you guys discovered when it comes to that combination, putting a UV device disinfection system at a hand washing station? What is the result?
The result is ultimately an increase in hand washing frequency. Every time you begin a CleanSlate cycle, it reminds you, please wash or please sanitize your hands. Every CleanSlate that is deployed, usually beside a hand washing basin, a hand sanitizer, or even we provide hand sanitizers to equip with our CleanSlate devices. When we started working with several Ontario hospitals in Canada, we saw ultimately those within beside CleanSlate or those within a proximity of CleanSlate, we see hand hygiene uses or frequency increases almost as high as 80%.
That's a lot.
That's phenomenal. So I think that's incredible. You guys were really smart to make that parallel and combination. So what they found is when you install a CleanSlate UV device disinfection system at a hand washing station, and they put in a simple counter technology, they were able to prove that they were driving hand hygiene compliance by having device disinfection in proximity to the hand hygiene station without degrading the hand hygiene use at other stations, right?
Correct.
So that's incredible. A lot of healthcare facilities are investing a ton of money in hand hygiene. We know that that's the low-hanging fruit. The CDC says if you can drive your hand hygiene compliance, that's a big part of the battle. And now we've shown that there's a direct correlation between device disinfection and hand hygiene. And I think that's fantastic.